Good afternoon, everyone. Thanks for tuning in today. My name is Jeff McKay from Brightsquid. We're going to talk about MyHealth Records, SecureMail, and your patients and how they all tie together. MyHealth Records is a service by the government of Alberta that's been around for almost a couple years now. And SecureMail was integrated into it back in May as a way to help patients connect with their providers and support continuity of care and the sharing of information and access to care through COVID-19 and beyond. So we're going to talk about a lot of things. Sorry, skipped a slide there. Before we jump in completely, I just want to point out there's a questions box in your GoToWebinar control panel. And feel free to submit any questions you have there as we go through. We'll do our best to get to all the questions by the end. And if not, we'll typically try to follow up with any questions we don't get to directly. So we're going to talk about patient engagement and activation. As I said, that's a lot of what MyHealth Records is all about. We're going to talk about framing the patient engagement experience. We're going to talk about some actual patient experiences, sort of patient testimonials about using secure messaging, access to lab recs, their lab results, that sort of thing. And we'll go through what MyHealth Records is exactly, talk about how patients can use it, because there's a lot of different tools in there that help patients collect, store, and share all of their information. And then we'll talk quickly sort of how the sign-up process works, because there's been some changes in the last couple of months in terms of the accessibility and the usability of MyHealth Records that have really helped a lot. Here we go. So looking at the case for patient engagement, and what MyHealth Records aims to do, as I said, is it's a way to help patients access their information, keep it all in one place, and we'll look at all the different types of information that they can collect there. But really, the reason that we want to engage patients, there's lots of them, but framing it around the quadruple aims of healthcare here, engaged patients are healthier. There's research. This is looking at just one research project. It was done by Kaiser Permanente, looking at, I believe, 35,000 patients that found, as much as an 11% improvement in patient outcomes just by engaging patients in a secure messaging over, a certain period of time. Showed that patients did end up healthier than a control group. Engaged patients are more satisfied. So secure messaging has been shown to improve patient satisfaction by 44%. And that's just being able to connect with your clinic to, ask about appointments, ask follow-up questions, ask prescription renewals, that sort of thing, just sort of basic patient management. The most engaged patients cost healthcare 21% less than the least engaged patients. So as we look towards the looming growing gap in the sustainability of healthcare with an aging population, we need to look at ways that we can help lower the cost of care. And engaging patients is one way to do that, because I always think about the healthcare system as a bit of a river, and when patients need care, and we all need care, we end up jumping in the river or getting placed in the river, or maybe even falling in the river. If we're in the river with a boat and a paddle, and we can be active, we're more likely to get down safely, more quickly. We can get access to the help we need, rather than just floating along and bumping into rocks. That's a bit of a rough analogy, but it seems to work for me. So, the better we can have patients as a participant in their care. And that's really what MyHealth Records and SecureMail with the integration aims to do. Include patients in that healthcare community that is serving them so well. And so we're also going to talk about, we can talk about how engaged patients actually support provider satisfaction. And a lot of that has to do with, it helps patients be healthier. So providers are more satisfied because they're actually doing their job. They're actually impacting patient health in better and more ways, and they're actually able to be more effective and more efficient and actually treat more patients. So that has been shown to improve patient provider satisfaction. Just to talk about the patient engagement experience and how that looks. When patients have access to their information digitally, we've in most other aspects of our lives, we've moved on from the analog world. So this is a great story that really outlines how this all works. So a patient had an upcoming physical. Their doctor used Brightsquid to share requisitions in advance of the appointment. So we knew, we got about a month out. The clinic can just send attachments, hey, go do these tests. And when the blood work came back, it showed some other areas to do some further investigation. Um, and that was shared with the patient from the provider, along with additional tests to be done. And then so that work being done in advance, now the actual appointment is much more focused and much more productive, because the patient has a sense of what's going on, what's important, what to talk about. The physician is focused on, hey, I know these are issues that we need to look at and address. And in that meeting, now you actually have a plan and you can establish that. And this is an actual patient case that we received about 2 weeks ago. And we have hundreds of these types of things. So we'll look at a couple of them. You know, COVID-19 changed a lot of things. We saw the traffic on Secure Mail alone triple in terms of patient use. So patients have said now from between March and May, the number of messages sent on Secure Mail by patients tripled. And now we're seeing 60 to 70,000 messages a month. That's between providers and patients, with about 3/4 of those messages being sent by providers or clinics to patients, and about a quarter of them patients to clinics. So, here's a great example. COVID-19 hit. I had a spot up here on my face. Early days of COVID, we all remember people weren't really going to clinics. Clinics were sort of, operating as need be. And, someone with a spot on their face, not necessarily going to get seen very quickly in clinic. But this patient was able to take a picture on Secure Mail, and that's kept very safe and secure. It's not uploaded to the iCloud, for example, and just send a photo. The doctor could forward that to a dermatologist and say, hey, what do you think? And the dermatologist, all through Secure Mail, which can be connected into the the patient MyHealth Records account, was able to see the photos and say, you know what, I need to see that, and book an appointment through the same system. So, we're avoiding appointments, travel, wait times, delays, all that stuff by digitizing our communication in a safe and secure way. And now that's connected back to the patient record. So the patient has one place to look at their test results. They can look at their appointment schedules, all that sort of thing in one place. And we'll talk about that in a second. So what is MyHealth Records that was sort of created and released by the government of Alberta? So it is an online tool. It's a website. It's a web destination. It's very secure. It lets Albertans who are 14 years of older see their health information from Alberta Netcare and provincial electronic health records, and some other things. We'll talk about what's all included in there. Some of the stuff is self-reported, and some of the stuff is accessed. So patients can keep better track of their health. They can get, store, and manage and communicate about personal health information, and they can use it on any of these devices. So anything that they're used to, they can use it on their phone, they can use it on their tablet, they can use it on their laptop, their desktop, anything with internet access. It is secure. So the process, and we'll talk about this a little bit more detail, to get an account, you actually have to create an Alberta Digital Health ID. So you need to use your driver's license or Alberta ID card, and you need to use your health card to get into the system. The government actually will mail you, once they've verified your identity through the information that you give them, they will mail you an activation code. So previously, when you created your account, you had to wait. In my case, I think it was only 2 or 3 days for the letter to show up. They say up to 10, but it's usually much faster than that. So before you could even access your account, you had to wait for that letter to show up. They've changed that. So they've actually given patients a 30-day grace period to access their MyHealth Records account. The assumption being, hey, you've provided this much information. We're very certain you are who you say you are. If you don't receive and input the activation code within 30 days, they will lock up the account until that is done. So it gives patients a great period so they can get in and see it, because there's some really good things around COVID-19 that we'll talk about in a second. It's regularly tested by third-party auditors. It is very safe, and even going through the process of creating an account actually made me feel more secure about doing this. And there's other precautions, like if you don't log in for a year, your account, you have to reset and do everything. So so there's lots of protections in place. Going back to the patient experience, patients want to communicate regarding test results. People who have standing lab recs that want to track their progress, track their results. Are my levels changing? Am I improving? Am I going in the right direction? My health records gives patients the ability to see that, and also through the SecureMail integration, get interpretation with their physician and have a discussion about that in a way that makes sense with the modern life. We'll see another quote about that in a second, but they feel much more confident with the electronic being secure, using both of these systems. And the patients have recognized this makes it easier for providers. What's great about communicating this way is that there is no need to align schedules. And when we collect patient stories, there's a few really good ones. People talk about, I don't have time to talk to somebody 9 to 5. I'm self-employed. I need to be free and available for my customers. Or, I'm a frontline healthcare worker and I give really defined breaks where I have 15 minutes, and if I can't get through to a clinician or they don't call me at that time, it's not going to work out. But I can always check a SecureMail message or log into my health records and see my results there or something. So it gives people the freedom to access information without relying on other people's schedules and having that online, because these days it gets more and more difficult. When this person points out, using a secure system like SecureMail, I have no more worries about my email being hacked. We all heard the case in Calgary late last summer or 2019. A physician was using Gmail and that account was hacked and 7,000 patients were put at risk. So patients know that using email is a problem. It's convenient, and SecureMail gives you that convenience and the security that you need to make sure everybody is protected. My personal records lets patients access a lot of different things. The primary thing right now, and this has been a really good driver for signups. So I think there's close to 400,000 patients using MyHealth Records now. I know the last time I talked to Alberta Health about it was about 2 weeks ago, and they were over 350 and growing fairly rapidly. COVID-19 has been a big driver for that for a couple of reasons. Now you can access your test results, and they typically show up faster than patients would get a call or a text saying, here's your results. So people can check there as well. The big change that they made in September is that parents can now access the COVID results for their children. So, if there's an issue around returning to school, you can have those results much more quickly and access your child's results through your MyHealth Records account if you've got children under 14 years of age who can't have their own account. You can see medicines dispensed. You can see most immunizations. So if a patient gets their flu shot through AHS, like I do, that shows up in there. So anything that's been provided by the government, if they don't get it through shoppers, then it shows up. Any other sort of government mandated immunization show up and through there. Common lab results, we'll look at what they are. Patients can keep journals to track mood, sleep, weight, eating, that kind of stuff. You can upload information from personal health devices like Fitbits, and download reports. So any lab recs that come in through Netcare, for example, should be in there. And they can also store different bits of data and share those records with someone they trust using SecureMail, and exchange messages with healthcare providers. So if they have a caregiver, right? If you're talking about an elderly patient who is, has their children helping manage their health, or their neighbor, right, working with their caregiver, they want to share their information with them. They can do that by accessing that information there. And then have conversations with their healthcare community or their circle of care. That's what the integration with SecureMail is meant to do, to support the continuity of care that sometimes gets fractured when patients don't have that kind of access to their clinic. That's what drives things like emergency visits that are unnecessary, or going to the walk-in clinic, or accessing care through something, an online service such as Babylon or Maple or Lumino Health or something else that fractures the continuity of care and the patient record and doesn't support the medical home that we want to see. So here's a quick shot at available test results that patients can see through their MyHealth Records account. There's a few different ones within this. This information is available if you go to myhealth.ca/records. myhealth.alberta.ca. You can see more detail about what tests specifically, but here's the standard ones. So, patients that are, tracking their health through this kind of stuff get that access. And, a great reason beyond just patient engagement to give patients access to their information like this is travel time. Especially now, people don't want to travel. If people are have to use public transit to get to their doctor's office, that puts them at risk. Just accessing care puts them at risk. So anything we can do to improve the digital or remote access to their healthcare information, or even access to care, is supportive of the greater health. Right? We can help impact or flatten the curve in the COVID-19 spread, which right now is a pretty big deal. We can keep people at home by giving them access to the information and access to care this way. And there's a lot of different ways that care can be conducted on a service like SecureMail. In this patients, we get a lot of comments like, it's been a life changer. Thank God for Brightsquid is something, when I look through the hundreds of submissions we have, I see that phrase multiple times. Patients are excited to be able to engage in this way and actually have the ability to be a member of their healthcare team, which is what these services do for them. There are 2 steps to create an account, as I said. So the first one, just if it's something that you're going to bring up to your patients and say, hey, you should get in this, manage your care, manage your information. It'll really help you be involved and engaged as a patient, which is great for your health. They need to get an My Alberta digital ID. So if they go to that site, myhealth.alberta.ca, they'll be able to create a MyHealth digital ID. And then once that's created, at the same time, now they can create a MyHealth Records account and get access to their information right away, as I said, for that grace period of 30 days. And the site actually is very helpful. There's videos that sort of help with the process. There is a dedicated support line that we'll talk about at the end. But the dashboard options for setting up your personalization of your MyHealth Records account is actually fairly robust. This shows up in a big list, but that I cut and pasted in here from my own account. So any prescriptions that are in Netcare can show up. You can have information about your allergies. You can keep track of upcoming and past medical appointments. Oxygen saturation, blood pressure, pulse. This is when we look at things like your Fitbit. You can track your blood sugars. You can have your contacts. Who are my different providers that I work with? All that kind of stuff. Your exercise journal. There was a great comment from one patient who said, "Hey, it's a great way for me to keep up to date or keep accountable for my exercise regime because I'm a senior and all senior exercise programs are shut down because of COVID-19." Height graph, not important for all of us over 18. Your BMI stuff, your immunizations, right? If you want to go back and see what have I had, any government provided immunizations are in there, I believe. Immunization, or insulin, sorry, journal notes, right? What's my sleep journal say? What's my food journal, all that kind of stuff, my weight journal, and that's stuff that's being tracked, and that's information that's being shared through SecureMail. We see that from patient feedbacks and things like that. And so looking at lab test results, these are big ones, and the ones that are checked off are standard, and you can customize. Medical conditions, right? If you've got a new diagnosis, you can keep it in there and have reference and collect information about it. One of the ways that SecureMail is used heavily is clinics, once a patient has a new diagnosis or there's more information about their condition, hey patient, here's some brochures about what we have, or what you've got, and here's the latest data. One of the things that we'll be releasing tomorrow in SecureMail, for example, is the ability to send templated messages to a whole lot of people. So if you have a certain panel of patients that you want to send information to, you can create a panel list and send them all that one message instead of sending the same message 57 or 157 times. You can send it once, and it's all secure, and it is like a BCC, so nobody sees anybody else's email address. so that you can keep people updated and fresh without having to call them or without having to bring them in for an appointment and waste clinic time and waste their time with travel. I think the average stats on travel time for patients to an appointment is an hour and a half. So it takes an hour and a half of a patient's day on average to get to an appointment and back, and they're in the office for 15 minutes. So that's something to keep in mind. And that's a lot of the feedback when we look through and see, here's the patient experience or the story about how they're using it. Using it to eliminate or reduce my travel time, especially now in COVID-19, is a big plus for a lot of people. So there's a lot of things that people can do with MyHealth Records to help keep track of the information. And within the system, so this is kind of what it looks like at the dashboard. All that stuff was on the home screen. So if we were clicking here, we would see that list of what you can do for your dashboard options, what you've selected. You can look at your health summary, you can look at results and readings, like what I've got here. I can go to my journal entries. The secure mail is under the messaging tab. So this is on their home screen when they log into MHR messaging, or MHR, sorry. And they'll get this sort of blurb that talks about what secure mail is. They're actually taken out of MyHealth Records. And now, because of the identity validation that the government of Alberta does, any patient now can create a secure mail account. So you might start to get messages from patients that you haven't invited yet, because now thousands of patients are creating their own MHR account. Like I said, I think it's probably about 375,000. Tens of thousands of them have connected to secure mail. So they're coming in and they've got their own secure mail account, and they can start looking for their providers in the secure mail directory. So on that note, everybody should make sure that you go into your account settings in secure mail and make sure that your clinic name is accurate. Make sure that your physician names are showing up properly in the system, because that's how patients are going to search for you in the directory. Make sure your specialty is up to date, all that kind of stuff. And if you need help with that, always call our support team, or just get on chat, email us, whatever you need, support.brightsquid.com. So then they come in here, they can launch Brightsquid. If they haven't set up an account, we'll actually, Alberta Health passes their information, their email address and their name and their date of birth from a data sharing standpoint, to make sure that we're validating them when they come into the system. That's the information that you need as a clinic to make sure that you're communicating with the right Jenny Smith. When patients get the opportunity to engage as a member of their team, it's very exciting, it's very fulfilling, it's very rewarding. And it's a bit of a relief for a lot of patients, because now they can actually help manage their health, because, me as a patient, I know I'm the only one who really has ongoing, continuous vested interest in my care outside of individual interactions. So, here's a great story. Talk about, diarying. From receiving food diary to filling out, sending it back, keeping in touch with their circle of care. In this case, we're talking about a dietitian, but also with my whole health team. Secure Mail uniquely puts patients into their healthcare team, because they can communicate with any members of their team, and any members of their team can communicate with the rest of the team as well. And that means they can send it to everybody all at once, or have individual one-off conversations. So, like I said, there's patient support. And they can get help setting up. If they have questions, they can actually talk to a health league nurse if they do this, if they can't get through to anybody else at your clinic. They can get help signing up. So it actually is quite a good system, and they're usually quite available. I don't think there's much of a hold time typically with them. Now, before we get on to questions, we want to talk about the winners of the draw. So most secure messages sent in the last 30 days, that prize goes to Liz. So Liz, congratulations. Most secure mail invites. So this is looking at patients, and this is also looking at providers, because it's important that you're using secure mail with both as we build out that community, that healthcare community, get everybody connected. And that's where secure mail really has its power, with the integration into TELUS Health Med Dialogue, MyHealth Records, and any provider in any discipline can use it. So that's for Allison. And for showing up today, Sue wins a prize. So congratulations to our winners. Now let's get to some questions, because we do have some. And really the value here for MyHealth Records is that we're giving the opportunity for everybody to get involved and everybody work together to support better healthcare. We look at that cost coming down the line with an aging population. We need to do everything we can to make it more efficient and effective. So let's see. What value for remote digital diminish if there's certain pieces of information on a health record that would not be shared with? So, well, so the reason for, so if we're looking, digital access diminishes if there's information that would not be shared with primary care provider or specialist. I mean, that's up to the patient. I mean, the information that's in there, we're giving patient that information if now for the first time, and they can share it with anybody they need to through the secure mail integration. So, that's kind of the value that the government's trying to add by giving patients and letting them kind of be that person there to manage the sharing of their information. And I hope that answers the question. So there are billing codes absolutely available. A couple examples: 0301S is the billing code for secure messaging with patients. That is $20. It's capped, I think, at 14 a week, and you'd have to look at what the ability to use that is. In certain cases, I think like you can't have seen the patients within 24 hours on either side of that. And it has to be in response to patient-initiated contact. So, you can tell your patients, if you have questions, send us a secure mail message and we can respond to that. Some clinics will send out questionnaires and have patients in the back. If you have a panel of patients that need to come in for a physical because you haven't seen them in a long time, hey, we'd like you to fill this out just to kind of keep proactively in touch. It's a great way to help manage your panel without having to call them all or just wait for them to reach out to you. You can also use secure mail for e-consultations. 0301R is for a request for an e-consult. 0301O is for an opinion response from a specialist. And then some of the codes that were made permanent, and I can't remember the code exactly. There is one for digital communication. In the description, it doesn't say secure email, but if you look at the billing corner update, it actually explicitly lists secure email communication as something that would qualify for that code. And so that was the one that was brought in for the pandemic. Yeah, so can you upload a CSV data to MyHealth? I actually am not totally sure. There are a lot of different file formats that you can upload. I know PDFs. I think you can upload CSVs. A quick call to the support line would answer that for sure. So I'm not totally sure on CSVs, but I think so. So this question is looking about, next question, PCNs that haven't moved to emails. So, that's kind of the state we're in. The industry is in a state of transition as we move towards digital transformation. We're in the state of digital transformation in healthcare right now. There are clinics that are still in analog. I know of clinics that do not have internet service in their clinic, largely due to they're being overwhelmed with the idea of dealing with the threat of digital access that comes with cybersecurity and that sort of thing. It is not a technology problem. Dealing with internet, dealing with cybersecurity, and we help hundreds of clinics throughout Alberta come up with the right privacy plan to make sure that they're doing things properly and safely on an ongoing basis. We provide privacy compliance training. We provide cybersecurity training to users. We've done that to thousands of healthcare professionals through the province. We actually specialize in Alberta privacy. So there's lots of different ways that people can do it. Yes, unfortunately, not all clinics are on board. As soon as you mention email in a clinic, they say we aren't allowed to email. That's illegal. That's true. You can't use email, but there are email-like services like Secure Mail. I think there's one in the Accuro EMR that can be used. That's really good. You just have to make sure that the service you're using is accepted by the OIPC. They are the governing body for privacy compliance in the province. So, part of the thing that, patients are doing now is they're going to clinics because now that they have access to secure mail through MHR, it's like, hey, I'm using this service. How come I don't find you in the directory? And they know that this is an option. So more and more clinics are getting pressure to get on board. So by being SecureMail users, people, professionals, clinics that are using it are ahead of the curve, and that curve is that adoption curve is getting pretty steep. It's getting steeper and steeper by the day. We get more and more calls for clinics looking to get access to SecureMail because it's, from a patient perspective, from a customer service perspective, it's such a valuable tool. Now I see that we're at the end of our time. Thank you so much for tuning in today. Hopefully it was valuable. We will be sending out the recording so you can share it with other members of your staff. And always, if you have any questions, please give us a call about using SecureMail. We do support patients as well. So any patients, if they call you with questions about how SecureMail works, please just direct them to us. That's not your job. You shouldn't be spending your time doing that sort of thing. So thanks again for your time today, and have a great rest of your week.